just introduce you to CareLineLive first of all. We are an award-winning, all-in-one cloud-based home care management software. We work exclusively with home care providers. So CareLineLive helps improve efficiency, capacity and compliance by digitising workflows, so getting away from paperwork and automating processes such as rostering and payroll and many, many other things as well. So the way that this webinar is going to work is Merina is going to talk for up to 45 minutes, and we've advertised this as a 45-minute webinar. We've then got 15 minutes if you would like to stay around to do Q&A. Now, given the numbers of people that are in this webinar today, we are not going to be able to answer everyone's questions, but we will take a note of what all of those questions are. And Merina and I will write some blog posts and social media updates in the coming days to cover off the commonly asked questions. Now, if you have a question, rather than putting it into the chat thread, if you look at the top of your screen, you should see a Q&A button. And if you click on that, what we're going to try and do is organise the questions into sort of themes. So if someone asks a question, I don't know, what is the time frame for such and such? If people want to answer that, they can answer within that thread. But if you've got a different question about something else, you can ask it in another thread. OK, so hopefully that's all clear. You're welcome, obviously, to comment on any of our social media pieces about this and ask further questions as time goes on. So, Merina, I'm going to hand over to you, if that's all right, and you can introduce yourself. I should say, just for the people that were slightly later, I'm Marie Page, the marketing manager at CareLineLive. In the background is Nick Shah, who is our operations director, and Merina will introduce herself now. Over to you, Merina. I'm going to put myself on mute.
Hello everybody, thanks for joining today. I'm Merina Martin and I'm the home care champion at CareLineLive. You might ask yourselves, what does a home care champion do? Well, I keep all of our customers and a wider audience abreast of what's going on in the industry, not just in England, but in the rest of the UK, so in Scotland, Wales and Northern Ireland, and also with our operation in Australia. So just to say that the Australian market is going through the same as we are at the moment. If you want to reach out to me, please reach out to me. You can email me at mm@carelinelive.com. You can head over to our website at carelinelive.com, where we've got all of our information, all of our blogs on the new single assessment framework, and a lot more information on the website. And also you can follow myself and CareLineLive on LinkedIn. So just to give a little bit of context about what we're doing here today, is that there's a lot of issues around what's going on with CQC. People are a bit worried about it, and there's a lot of confusion around what's happening with the new single assessment framework. And in terms of home care, my credentials are that I am very experienced within the domiciliary care market. I've worked in senior management. I have also been a nominated provider and also a registered care manager. I've worked a lot in startup environments and also done a lot with businesses that are struggling, so a lot of business improvement and business troubleshooting, and obviously I've got a lot of CQC experience as well. So I just wanted to sort of take us back a little bit and just have a little look at why CQC and us as providers feel that there is a need to have some change. So looking at ratings, there's always been that inflexibility of ratings, and actually service has been stuck with the same ratings for months, if not years. So a good example of that is I'm very involved with a residential care home at the moment, and they are fantastic. The care that they're delivering is amazing. The support, the staff are brilliant, and they've actually been stuck with a rating of requires improvement for almost 4 years. Well, we all know that that just can't continue. So CQC are recognising that. I think there's also been a lot of discrepancies in terms of rating decisions and a lack of transparency as to how rating decisions are reached. Also, I think CQC have definitely had an approach of one size fits all, and that just doesn't work. You know, domiciliary care is very different to hospitals, residential care homes, supported living, whatever the service might be. And I think there's also been a lack of objectivity and thinking outside the box, which has led to care providers really not being able to showcase how they are improving and the fantastic innovative ways that they work, especially after the pandemic. You know, we all had to change our ways of working, and it's a great opportunity to have this new single assessment framework to be able to showcase exactly what's happening within domiciliary care now, and obviously across the board for health and social care. In terms of inspection, we all know what those pressures are like, and I personally feel that inspectors can't get a good overview of a service on a one-day inspection or a 3-day inspection or a week's inspection. It's not a realistic view of any service. And in terms of support, my personal experience with CQC is that support has been good. Although I do have to say, in my experience, I haven't had a designated inspector unless I've been working with a service that needed a lot of improvement or there was dire issues going on in that service. So I think the lack of specialist teams and the lack of good communication has been really difficult for providers. In terms of communication, we all know what that's like. You know, you upload a form to CQC, you know, you email it to them, you don't get a response for months on end or weeks on end, and also not having that key point of contact. And what I've found personally is that unavailability of inspectors, because of course historically they've been out inspecting different services, and that just doesn't help to build really good, strong relationships with CQC. So looking at their IT, I know we've got problems with their IT at the moment, but you know, the lack of good IT and communication exchanges has been really difficult. So it's made processes, for example, registration, long and laborious. And also, I know you will all agree that, you know, we've always been duplicating so much information. So looking at the aims of the change, well, CQC really do want to have a much more agile way of working. They want to be much more responsive, and they've got 4 main themes that they are working to at the moment. They want to be much more in touch with people and communities and service providers. They do see the need for much smarter regulation, and they want services to be showcasing how safe they are and how they're learning to improve. And also that improvement, they want to see an accelerated improvement. So I feel that there's going to be much more control for service providers. They also want to give people a voice. They want to know what's happening with people in communities when they're trying to access local services. And of course, they want to address the inequalities in healthcare that we hear so much about. So, for example, if you're a community in Kensington, your issues are going to be very much more very different to communities, say, in the east of County Durham. So they really do want to get really in touch with what's going on at ground level. And of course, they do want to see current and up-to-date view of services. They know that having information about services that are 2, 3, 4 years old is not productive. They also want to show and be seen to be much more consistent in the way they're doing their assessments of services and in the way they inspect. And of course, they want that process to facilitate service providers to be much more compliant, to have a good understanding of compliance, and that service will improve from the learnings from all that continual assessment. And of course, again, they don't want services to be stuck with the same ratings for long periods of time. So that is their aims. So looking at what's happening with CQC themselves, I think we have to be a little bit sympathetic. And I know we get very frustrated with what's happening with CQC and the amount of information that's being constantly thrown at us, but they are going through significant organisational change. So we're just going to have a look at what those changes are going to mean for CQC themselves. So there's going to be 4 geographical regions: North, South, Midlands, London and the East. There will be what I consider umbrella teams. So there'll be teams for adult social care, hospitals, primary care services and specialist sector teams. So we will have specialist sector teams for domiciliary care, which can only be an absolute bonus for us. In terms of those teams, there will be localised teams. They will consist of inspectors who will be looking at risk, safety, enforcing regulation. They will look at factual accuracy checks of the information that you are giving them as providers. There will be assessors who will be reviewing the data with the inspectors. They will work off-site. They won't be doing any inspections. So they will just be reviewing all of the data. There will be regulatory coordinators who will take general inquiries and point people in the right direction. And of course, they will be supporting the assessors and the inspectors. And overseeing those localised teams, there will be operational managers. So you can imagine what an upheaval this is for all of those people working within CQC at the moment. So in terms of what's changing and what's not changing for providers, you're still going to be completing your provider information return. That is not changing currently. Also, the regulations and fundamental standards will not be changing. So they're quite fundamental things that you don't really have to worry about at the moment. CQC want to see their process evolving and that continual process of assessment. So what I would say to you is that what we're seeing today might change, but I can't really see that there are going to be too many significant changes. If there are any significant changes, CareLineLive, myself and Marie, and through our social media, etc., we will be updating you as to any changes at all. CQC want to be much more transparent right across the board, and they want care providers to be much more have a much improved understanding of compliance. And I'm really sure that this new way of working in the new single assessment framework is going to give care providers a much better understanding of what CQC are looking for. We are going to get into the nuts and bolts of that later. And obviously CQC can see the need for them to have much better and stronger working relationships with service providers. So what else is changing? Well, of course, we've got the new provider portal. Now, I know there's been a lot of issues with the portal. Congratulations to the people that have managed to use it and register and do everything that you should be able to do with it. And hopefully those who haven't been able to register will be able to do so soon. So what can you do at the moment? Well, if you're a new provider wanting to register, you can register online, you can upload the supporting documents, and thankfully new providers will be starting with a rating of good. I think that gives new providers a really good bolt-hold into the industry. You can make some of the registration amendments with the portal at the moment and some statutory notifications. I just want to draw a line under that for the moment, because I know that that's what we can do. Just to end that little part of the provider portal, I just want to say that yesterday, I'm sure a lot of people that are on this call did get an email from CQC apologising for the hiccups with the new provider portal and giving you information about how you can submit information to them. So do have a look at that. If you are not registered with CQC to get their updates, please do go to the CQC website and make sure you're subscribed to the Citizens Lab and also to the newsletters and their updates. That's really important. It just keeps you on the ball with everything that's going on. So getting back to the provider portal, what you're going to be doing eventually is submitting your evidence for analysis. In return, you will get a monthly download which will show you exactly what your rating is and where you are in the rating band, as it were. I'm going to show you an example of how I think that's going to look. You will also, from that monthly download, be able to do a factual accuracy check of the information that you've given CQC. So you will be able to check that download. And of course, we're hoping that there'll be better exchanges of information. So looking to inspection, we've known for some time that inspection is planned to be much more targeted. And from what I understand from CQC, this is definitely going to be the case. So with current inspections at the moment, CQC are focusing on services that have ratings of inadequate or requires improvement. And they are focusing on the quality statements that relate to that part of the ratings. So for example, if your requires improvement in the key question of safe care, the Care Quality Commission will be focusing on the quality statements within that key question. We're going to get onto that in a little while. They will also inspect when there is a clear need to do so. So if they're responding to lots of incidents that a service is experiencing, concerns, risk, safeguarding, those types of situations, if they feel the need, they will target and inspect. They will also inspect when there's limited information available to them. So that means that if you are not engaging with the new ways of working with a single assessment framework, you are going to find that CQC is going to come and inspect because they want that information. They need to know that you're running a robust and safe service. If you're not using technology at the moment, if you're paper-based, please do think about digitizing your system. It's going to be much more beneficial for you and save you a lot of headaches. So please do make that a really firm consideration. There will also be services that they will need to inspect as a matter of course. So some services will always be inspected and have a face-to-face inspection. Or there might be a time when they think a provider's not engaging as well as they could, so they would like to have a face-to-face inspection. But that is not in their game plan. What they're trying to do is have this continual assessment process where inspection will only be as needed. So in terms of what's changing, so at the moment we've got Chloe's and we're transitioning to key questions. They're the same. There's nothing changing with the Chloe's are now going to be called the key questions. So we will still have the key questions of caring, safe, responsive, effective and well-led. Those key questions will be underpinned by quality statements, and each key question and quality statement will have evidencing categories, and that is what you will add your evidence to. They give you guidance as to what CQC want from those evidencing categories. So looking at the quality statements, there will be 34 quality statements, which is fantastic news. We have previously had over 300 sub-questions under the key lines of inquiry. There will be no more. We will simply have 34 quality statements. The quality statements give you as providers guidance as to the expectation of CQC and the standards of care that people should expect from you as providers. The quality statements, it doesn't seem that CQC will be using every single quality statement to assess services. This will be very much dependent on service type and national priority. And when I say national priority, I mean if the national priority is that safeguarding is an issue nationally in home care, they will definitely be focusing on the key question of safe, perhaps. That's not to say that you shouldn't be collecting lots of evidence for your quality statements as well. I would be collecting evidence against all of the quality statements. I think that would be good practice. In terms of how the quality statements are written, they're written as we statements, what we will do as providers. And there are I statements, which are what I can expect as a service user. So that's your quality statements. We're going to have a look at the quality statements in a little bit more depth in a little while. So there are evidence categories which underpin the key questions and the quality statements, and these are the categories that you are going to be providing evidence against. So the categories are people's experiences, feedback from leaders and staff, feedback from partners, processes, outcomes of care and observations. If we look at those top 3 evidence categories, CQC want you to get as much feedback as possible from anybody that has anything to do with your service, whether it be people using services, whether it's from your staff, leaders, and from partners, so your local authorities, your GPs, etc. Now, they don't only just want the feedback, they need to know exactly what you are doing with that feedback. They want to know that you're developing your service, that you're improving your service, that you're improving safety across the service. They want to know what you are doing with that feedback, so you really need to make it clear as to what is being done. They want to see that you've got robust and up-to-date processes and policies, and that they are being updated regularly to reflect how you are improving and learning within your service. They want to know that your care planning is excellent, that it's detailed, that it's meeting the needs of people, that people have got good outcomes. They want to know that you're regularly reviewing and updating care and support as necessary. Observations is a bit of a strange category in terms of domiciliary care. Currently, CQC will not be observing care at home for domiciliary care services. However, if I was a provider of a service, a domiciliary care service at the moment, I would take the observation criteria on board, and with my spot checks, appraisals, supervisions, if there was opportunities to observe care and report on care, that's exactly what I would be doing. In terms of your evidence categories, you need to make sure that you've got a good system to collect all of this evidence. I would suggest that you have key question folders, that you add the quality statements to in subfolders, and then you add your evidence to those subfolders. In terms of the type of evidence that you're going to be asked for, CQC will be looking at the type of service that you are running. So if you are a domiciliary care service, you will be asked for much different information than hospitals or local authorities or integrated care systems. Your information is going to be different, and it will also depend on whether you're an existing service, or whether you're a registering service. So there's much more flexibility around the type of information that they are going to require. So how are they going to rate? Well, this is quite up in the air at the moment. I think what we've got here is a good overview. Some people within the industry have got a slightly different view about the amount of the calculation that will dictate your scoring, but I'm just going to go through how we think it's going to look at the moment. So there will be scoring from levels 4 down to 1, 4 being excellent care and 1 being poor care, inadequate care. The maximum score that you will be able to achieve is 24. And whatever score you achieve, it will be calculated into percentages, and that will give you your rating. Now, I think the good thing about the percentages that there are bandings within those ratings, so you will have an idea of where you sit within the bandings. So if you're an outstanding provider, you will be scoring 87% and over. If you are rated as good, you will score between 63% and 87%. If you require improvement, you will be your percentage will be between 39 and 62%, and inadequate services will be between 25 and 38%. But it will be really interesting to see where you sit in those bands. So I think that's going to be very interesting and beneficial. So you'll be able to see where your room for improvement lies. So going back to the quality statements, I just wanted to have a look at one of the quality statements with you, just to give you an idea of how it will look and what is required. So looking at the quality statement of SAFE, CQC give you the regulations that relate to SAFE. So the regulations that relate to the key question of SAFE are Regulation 12, Safe Care and Treatment, Regulation 16, Receiving and Acting on Complaints, Regulation 17, Good Governance, and Regulation 20, Duty of Candour. So underpinning the key question of SAFE are quality statements. And under the key question of SAFE, there are 8 quality statements. So learning culture, safe systems, pathways and transitions, safeguarding, involving people to manage risk, safe environments, safe and effective staffing, infection prevention and control, and medication optimization. So we're going to look at the quality statement that sits with learning culture. So I'm just going to read it out to you, and then I'll explain what I would do with the quality statement. So the quality statement under learning culture is, we have a proactive and positive culture of safety based on openness and honesty, in which concerns about safety are listened to, safety events are investigated and reported thoroughly, and lessons are learned to continue and identify and embed good practice. Now, what that quality statement as a provider would be saying to me is, how am I investigating concerns, incident, risk, and what am I doing about it? What lessons am I learning? Of course, I would be, if I were hypothetically a service provider, of course I'd be using CareLineLive. So for this, if I ever had an incident, I'd be going straight to the feature that records incidents and concerns, and you would be able to get as much information in there as possible. So you would add the service, the type of incident, and the severity of the incident, who was involved, who was affected, the urgency that incident or concern or risk needs to be dealt with, details of when it happened, You could upload evidence, so if there's bruising or a cut or whatever it might be, you can upload evidence. You would say who the responsible person is, who's going to see that incident right the way through to conclusion. You'd be able to add which external stakeholders are involved, what statutory notifications you've made, a resolution time frame. When are you going to get back to the person and use your duty of candour to discuss what happened within that incident or concern? And the very important thing, which I love about this feature, is that you can add how you responded to that incident. So how you've met those key questions and what learnings and implementation of improvement you have instigated into your service. So you've got it all there, you've got all that information, you can download that as a report and give it to CQC. So in terms of information going forward, I just wanted to highlight that I've written a number of articles about the single assessment framework and specifically about the key questions, the quality statements and the evidence categories. As you can see on the screen here, you can see that we've got the key question of safe there. I've also added into those articles information about types of evidence you can collect and that you can upload that would be valuable for CQC. So do take a look at them. Obviously, you've got your own types of evidence that are very specific for your type of service, but please do have a look at our blog and our resources that are on the website at www.CareLineLive.com. That'll give you a really good understanding and set it out very simply for you. In terms of what we think the monthly down road report might look like, I've taken an example from MOA Benchmarking, who are a fantastic company that we partner with. They are specifically, the software specifically designed for CQC, service improvement, compliance and auditing. And I'm very much hoping that we will get visuals like the screenshot I've got here of where you sit in each key question so that you can see exactly how well you are doing in each segment of the new single assessment framework. In terms of MOA itself, I just want to say that there's a lot of different companies that use MOA, and you will be able to benchmark yourself and see where you're sitting with other service providers. So it's a really good tool. I would advise you just to go and just take a look and see what you think of it. I actually think it's fantastic, and if I was a service provider now, I certainly would be using it. So looking at timeframes, well, we know timeframes have been very precarious. We know what's happening at the moment. CQC are having problems with their provider portal. So I think things are going much slower than CQC anticipated. But they are going to lengths to say that they want to get this right. So I think as frustrating as it is for providers, and I'm absolutely convinced that everybody just wants to get onto this new framework and these new ways of working. We've just got to go with CQC because it can't. We don't want it to be absolute carnage. So we are where we are with the provider portal at the moment. Hopefully they will iron out all of their issues that they have at the moment. In terms of what's happening next, last week CQC did state that they were going to announce a timeline for when the assessments were going to start. Now, hopefully that's still going to be in the summer. We don't really know. We've just got to wait for CQC to come up with when they're going to start the assessment process. And then looking to the future, this is just my prediction of when the whole single assessment framework will be rolled out. I'm very much hoping that it will be in the autumn or at the latest early winter. But I think, as I say, we do have to go with CQC and what they're comfortable with, because we need this to work properly. We don't want so many teething problems that we're experiencing now. So I think we just have to be patient and just embrace the new framework when it finally arrives in all its glory. I'm going to hand back to Marie now, and I'm very happy to take some questions when Marie has hand it back to me.
Thanks very much, Marina. That's super useful. So I've got a couple of questions for you already. If you look at the Q&A section, you'll see them, Marina. And of course, all of you that are on the call, if you would like to ask some additional questions now you've seen the whole presentation, please do so. It's probably best done in the Q&A section rather than the chat, because they do tend to get lost in chat. But yeah, we'll have a good look through them for you. So you may also be interested in downloading our ebook. This has been written by Merina. It's designed both for completely new providers that want to get going with very good solid foundations, but it's also a lovely thing to use for you to get some ideas for how you can improve benchmarking, you know, for instance, how you can do better with recruitment and retention, that kind of thing. So you can find that by going to carelinelive.com/ebook, or if you scan that QR code with your phone, you'll be able to register to get that there. Okay, so Marina, I'm not sure if you saw the question from Amran.
I'm sorry, I can't see the questions, Marie.
Don't worry, I'll read it out to you. If you are waiting for your interview as a registered manager, what different types of questions can you anticipate being asked during the interview?
Well, I think they're going to ask you about your qualifications. They will definitely want to know how well qualified you are. You do need to have at least your level 5 in leadership and management within health and social care. They will be asking about your financial position. They will be looking at various policies, including your safeguarding policy and medications policy, and they will be asking you questions all around your competency and your experience within the sector that you're applying to.
Thanks, Marina. So another question here. I'm having an assessment in the new framework. I'm not sure what to expect. Please advise.
Well, none of us are sure what to really expect. I think you've got to go with what CQC are asking you for. I'm presuming they're asking you for a variety of documents. I would be uploading them, doing exactly what CQC asks you to do. And I think you've just got to wait till they come back to you. None of us have been through that process, or very few of us have been through that process, apart from the people that have been piloted. So, you know, I'm not really quite sure what you can expect. Because we just don't know how they're going to run this at the moment. But I would say that I was on a webinar a couple of weeks ago, and there was a solicitor who's an expert in health and social care. She'd been talking to a CQC inspector the previous week, and he'd said that they were concentrating at the moment on 11 of the quality statements, and particularly in the key question of safeguarding and well led, with specifically to with regards to sustainability. So that's really all I can tell you at the moment.
Okay, so that question was from Ethioma, who also says that the documents have been uploaded and they're booked for a team meeting. So yeah, it'll be the questions that they ask at that meeting. I'll go to the next question in a moment. I just want to address quite a lot of questions that have come in about the slide deck and about a recording. So we will be emailing you the slide deck. I will send that to you as a PDF. I have also uploaded it to SlideShare, also known as Scribd. I know some of you are having difficulties getting an account with those. Don't worry. As long as you gave us your email address, we will be sending that through to you as a PDF, and we'll be putting this up on our blog as well. So if for whatever reason the email doesn't come through, I don't know, it goes to spam or something, take a look at our blog. It's in the resources section of our website next week, and you'll be able to download both the PDF and you'll be able to look at the recording, which we will also be putting up onto YouTube. So that should be useful for you. Thank you very much, Amran. So I have a question from Tracy. I hope I'm pronouncing that right. How can we implement the I and we statements to care planning, Marina?
I think with your care planning, you need to, I know it's controversial, but I suppose you need to look at the I statements in terms of exactly what people want from their care package. So your assessments of people really need to be very person-centred. The About Me assessment needs to collect lots of evidence around that person's likes, dislikes, their history, and it has to be just 100% very person-centred. I think one of the big things is to make sure that people's choices are a huge part of your care plan, as are the wishes and their wishes and preferences. And I think also when you are detailing the information to your carers, please make sure that if you're a CareLineLive user, or you use a different software, or even if you're paper-based, make sure those tasks are absolutely person-centered and written in the first person. So as part of your tasks, I would like to see so for example, when you're delivering personal care, I would like you to do such and such. These are the products that I like to be used when I'm showering, that type of thing. Just make sure it's person-centered and written in the first person.
Thank you. So a question from Rashiri. Do you have to send information of each and every incident to CQC?
I wouldn't say that you need to send each and every incident. It very much depends on the severity of the incident. If it's an incident that requires a notification, yes, you do. I would also say that all of your incidents and concerns, in my experience, my best practice was any concern, any incident, any risk, and also any compliment would be recorded and it would be monitored. And so I would say there is a possibility, yes, that CQC will want that information. Of course they will. So just make sure that you're really on point with your safety, that you understand all of the key quality statements. Especially I'm not saying especially, but you know, please do focus on the safety of your service as well. But that's not to say don't focus on all of the quality statements and the key questions, of course. I hope that answers your question.
Okay, couple more here. Dominic is asking, any idea of timeframes for new service inspections?
I have no idea of time frames for new inspections. I would imagine that it's going to be an interview that's going to be remote, but I really can't answer that question. I really don't know any timescales for that. I wish I could help with that because I know it's a huge bugbear for people. So apologies that I can't answer that one.
I guess what we can say is as soon as we do know, we will put it out on our social media and we will write a blog post about it.
Straight away. You'll know.
Another question here. What if the service user has no capacity to, and the care planning involved their next of kin? How can we then use the I statements?
I think that you need to try to use the I statements. I understand what you're saying. If somebody doesn't have capacity, that's going to be very difficult. But I think there has to be an element of trust in terms of using the I statements. And, you know, if a person has power of attorney, say, for health and well-being, I think you've got to go with that and use the I statements. That would be my advice. I think that's what I would do in that circumstance. I know it's difficult.
And I think that answers Ifeoma's question, which is when a client is unable to communicate preferences and needs, do you still use I? And I think the answer that we're saying is yes. Yes. Okay, the next one, Precious. How many registrations do you need as a provider on the new CQC portal? Do you need one for the service and one for the registered manager?
I'm actually not quite sure about that, but I would imagine that that will stay the same. I think you will need to register them separately.
Okay, Helen is saying, hi, please be mindful that you should never write I in a plan of care unless the person has written it or dictated to you.
Well, that is quite controversial, as I said earlier. I have had lots of conversations around this in the past, and some providers think that all care plans should be written in the first person, and some providers don't agree. So I really think that the jury's out on that.
Okay, Phil Eckersley. Oh, hello, Phil. You're one of our customers, aren't you? How long is everyone waiting to register a new care manager for a new business registration?
How long, sorry?
How long are people waiting to register a new care manager for a new business registration? Is that something you know?
That isn't something I know, to be honest, but I do know that I spoke to one of our customers who was trying to register a new service, and it was taking, well, when I spoke to her, it was 3 months she'd been waiting to hear. So I really can't answer that question either. I'm sorry. I know it's just a bit ambiguous because we just don't know what's happening with the new assessment framework.
I mean, if anyone's here that has done that recently, obviously do let us know how long that took. Jeremy says, if we are on requires improvement, how would we anticipate getting reassessed?
Well, I think as I said in the presentation, that CQC are going to focus on those services. So I think I'm not quite sure how you're going to be reassessed. I don't even know if they would come out and visit. I would hope that they are going to use the new single assessment framework and the provider portal so that you can upload evidence of your improvement, because it's quite clear that CQC only want to inspect when they need to do so.
Okie doke. Marina, do you want to just stop sharing your slides, because I think you'll be able to just pick up the chat comment yourself when you do that. Lovely. Now we've got a much bigger Marina on the screen, which is very nice. Right, another one. Joy Youssef is asking, how long after submission of PIR does inspection usually take place?
I can't answer that either, because we don't know with the new single assessment framework. You know, it's impossible to say in the old ways of working, you know, how long it takes when you've done your submission. You know, you get your time frames, but often they just don't, you know, that they don't equate to what actually happens. So, you know, this is all very sort of up in the air. We don't know how this is going to work. So I'm really sorry. Again, I really can't answer questions that, you know, CQC haven't published any information on at the moment.
Okay, so I think that's it. I don't think I've missed any questions. If I have, please do draw my attention to that. And we've done everything in 50 minutes, which is very well done. Thank you very much for your feedback, everyone. We really do appreciate it. Obviously, if anyone is interested in learning more about CareLineLive, do drop us a call. If you go to the website, there's a demo button there that you can just book a demo and talk to someone very knowledgeable about the system. And obviously, if you have any questions following up from this, I'd suggest that if you can obviously email us, but it may be appropriate to just keep it within a thread of some of our social media posts to do with the single assessment framework, or reply to us when we send those things out by email. They probably will be coming out to you next week by email rather than this week, just to let you know, because of we've obviously got to do some prep work ourselves on those now. Thank you so much,
everybody. Thank you for attending.
For your time in preparing and delivering this, Marina, and for all of you
very welcome
attend. I'm going to close the meeting now, Anjali. Thank you.
Thank you.